Hello, my name is Melissa. I am doing a presentation on emotional intelligence for nursing leadership and management at Polk State College. Registered nurses have multiple psychosocial risk factors due to the nature of the profession. These risk factors lead to high levels of job dissatisfaction, burnout, social problems, and stress. These factors greatly impact the quality of care that is delivered to our patients and families. Nurses must have the ability to manage their emotions and feelings and express them appropriately to care for themselves, manage their stress, and build therapeutic relationships with their patients. This is why emotional intelligence is such an important skill for nurses to possess. Emotional intelligence takes self-control, strong social skills, great communication, and an ability to motivate and influence others. According to Salovey and Mayer, emotional intelligence is the ability to examine our feelings and emotions, as well as the feelings and emotions of others, and to differentiate among them to guide your thinking and actions. Emotionally intelligent people can understand and manage their feelings. You may be thinking, why do you need emotional intelligence? Emotionally intelligent professionals exhibit less stress and anxiety, are more emotionally stable, and have better mental and physical health. They are able to build and maintain strong and authentic relationships with their friends, relatives, partners, and coworkers. Nurses must practice emotional intelligence to allow for a respectful and honest relationship with the patient. This trait is especially important in a leadership role, which requires excellent communication, understanding, passion, and motivation. Nurse leaders are faced with a multitude of tasks, such as building trusting relationships, developing partnerships, and meeting the demands of the organization. These tasks require that the nurse leader understands and manages the feelings and emotions of themselves and their employees. Their abilities and behaviors have a significant impact on the safety of the unit, employee retention, delivery of quality patient care, and patient satisfaction. A study conducted by Olson and Anderson, which was published in the Asia Pacific Journal of Oncology Nursing in 2015, found that high levels of emotional intelligence in leaders is associated with nurse managers that are competent and successful in meeting the needs of their employees, the patients, and the organization. The study also found that the need for nurses is going to continue to rise, and it is imperative for nurse managers to develop and use emotional intelligence to retain their employees. You may be wondering how you can build your emotional intelligence. Paulina Neal at Forbes magazine provides some tips on how to build your emotional intelligence. The first step is to recognize what you are feeling in the moment. How is that emotion affecting your mood or behavior? She then suggests that you identify it and name it. Is it anger, anxiety, fear, happiness? Naming the emotion allows you to detach from it and maintain your control instead of letting the emotion control you. Her second tip is to assess your strengths and weaknesses. She suggests using your strengths to your advantage and working on improving your weak areas. Neal's third tip is to practice mindfulness. This allows for the individual to be fully present and take in everything around us, and to listen with empathy and compassion in order to identify how others are feeling. The final tip is to practice social awareness. This is done by interacting with others, which enables you to recognize their feelings and mood through verbal and nonverbal cues. Social awareness helps with empathy and allows you to respond in an appropriate manner. I hope this video is helpful in explaining the importance of emotional intelligence, not just in the nursing profession, but in your everyday interactions. Thank you for watching my video, and thank you for your time.